They called it the miracle at St. Jude's. In 120 minutes of pure chaos, a ghost walked into the emergency room and pulled 20 people back from the brink of death. She moved faster than the surgeons and knew more than the specialists. But while families were hugging their survivors, the hospital administrator wasn't calling the news crews, he was calling the FBI. Because the woman who just performed a perfect open-heart massage in Trauma Bay 4 wasn't supposed to exist. Her name tag said Sarah. Her fingerprints said something terrifyingly different. The rain in Seattle doesn't wash things clean. It just makes the grime slicker. That whole Tuesday night, the I-5 was a river of oil and headlights. Inside St. Jude's Medical Center, the graveyard shift was settling into the low hum of monotony, the beep of monitors, the squeak of rubber soles, the distant rattle of a vending machine. At the nurse's station, Brenda, the charge nurse with 30 years of hardened arteries and 0 patients, slammed a clipboard onto the counter. "New girl," Brenda barked, not looking up. "Room 3 needs a bedpan change. Room 6 is complaining about the IV drip noise. Move." Sarah Bennett adjusted her scrubs. She was 32, perhaps 35, with hair pulled back so tight it looked painful, and eyes that seemed to be constantly scanning the exits. She had been hired 3 days ago. Her resume was generic, a few stints at nursing homes in rural Nebraska, a quiet reference from a defunct clinic. She was overqualified for the grunt work, but performed it with a robotic, terrifying efficiency. "On it," Sarah said. Her voice was low, a little raspy. She didn't make eye contact. She never made eye contact. Dr. Henry Matheson, the attending ER physician, watched her walk away. He was a good doctor, but tonight he was tired. "Is it just me, or is she?" "Strange," he asked Brenda, sipping lukewarm coffee. "She does her job and doesn't gossip." Brenda grunted. She could be an alien for all I care, just as long as she shows up. At 10:14 p.m., the monotony shattered. The red phone on the wall, the one that connected directly to dispatch, began to scream. Brenda snatched it up. Her face, usually a mask of indifference, went pale. "ETA!" she shouted. "How many, Jesus? All of them!" She slammed the phone down and hit the mass casualty alarm. The lights in the hallway shifted from dim white to a pulsing amber. "Listen up." Brenda's voice cracked like a whip. "Greyhound bus versus a fuel tanker on the interstate. Rollover. Fire. We have 30+ casualties inbound. 4 minutes out. Clear the bays. Get trauma surgeons down here now." The ER exploded into controlled panic. Gurneys were shoved against walls. IV poles were prepped. But Sarah Bennett didn't panic. While the other nurses scrambled, she walked calmly to the supply closet. She grabbed 4 extra laryngoscopes, a handful of chest tube kits, and strangely, a jagged pair of heavy-duty trauma shears that she tucked into her waistband. "Bennett!" Dr. Matheson yelled. "Don't just stand there. Get to Bay 1. The doors burst open. The sound hit them first, the screaming. Then the smell of diesel, burnt rubber, and iron. Paramedics flooded in a wave of yellow jackets and blood-soaked stretchers. "Male 40's severe crush injury to the chest," one medic shouted, wheeling a gurney that was leaving a trail of red on the linoleum. "BP is crashing. He's agonal." "Bay 1. Matheson ordered. "Female 20s. Shrapnel in the neck. Airway compromised," another yelled. "Bay 2. It was a war zone. The noise was deafening. Sarah was assigned to Bay 3, where a young boy, maybe 7 years old, was seizing. A massive laceration ran across his forehead. "He's post-ictal," the medic panted. "We couldn't get a line. Veins have collapsed." Sarah didn't wait for a doctor. Protocol dictated she call for a physician to place a central line or an intraosseous drill. But the doctors were drowning. Matheson was in Bay 1 trying to restart a heart. The other resident was overwhelmed in Bay 2. Sarah looked at the boy. His lips were turning blue. Oxygen saturation was 82% and dropping. Without a word, she palpated the boy's neck. She didn't go for the arm. She went for the external jugular. It was a move nurses were strictly forbidden to do without direct supervision, and even then it was rare. She uncapped a large bore needle. "Hey," a junior nurse gasped. "You can't do that." Sarah didn't blink. She threaded the needle into the neck vein in one fluid motion, established the line, and pushed saline. "Bag him," she ordered the junior nurse. The authority in her voice wasn't that of a rural nursing home hire. It was the voice of a general commanding troops. "Oxygen is coming up," the junior nurse whispered, stunned. 95%. Sarah was already moving. She checked the boy's pupils, stabilized his neck, and turned. "Watch him. If he drops below 90, page me." "Where are you going?" "To save the others," Sarah said. She stepped out of the curtain into the hallway, and that was when things went from chaotic to impossible. In the hallway, a paramedic was straddling a gurney. On it lay a man with a piece of metal rebar impaled through his upper thigh. The blood was bright red and pulsing arterial. "I can't stop it," the medic screamed. "Tourniquet isn't holding. It's too high up." Dr. Matheson ran out of Bay 1 covered in sweat. "Get him into OR. We need a vascular surgeon." "There's no time," the medic yelled. "He's bleeding out right here." Matheson froze. The injury was in the groin, the femoral artery severed above where a tourniquet could bite. The man had seconds. Sarah appeared at the foot of the gurney. She didn't ask permission. She didn't look at Matheson. She jammed her fist directly into the open wound. "Jesus Christ!" Matheson recoiled. "I have the bleeder," Sarah said, her voice terrifyingly calm. Her arm was deep inside the man's leg. "I'm manually compressing the iliac against the pelvic rim. Get me a clamp, a curved Kelly. Now." You're a nurse," Matheson stammered. "You can't be in there." "Doctor," Sarah said, her eyes finally locking onto his. They were cold grey and hard as flint. "Do you want to debate my job description, or do you want this man to see his kids again? Clamp." "Now." Matheson handed her the clamp. He watched mesmerized as she blindly navigated the gory mess of the wound, found the severed artery by feel alone, and clamped it off. The spurting blood stopped instantly. She withdrew her hand, slick with crimson. "Get him to OR. He's stable." Matheson stood there, the noise of the ER fading into a buzz. He had seen skilled nurses. He had seen nurses who could run circles around residents. But he had never seen a nurse who knew the blind anatomy of the pelvic rim better than a vascular surgeon. "Who are you?" he whispered. Sarah didn't answer. She was already running toward Bay 4. The clock on the wall read 10:48 p.m. 34 minutes since the first patient arrived. The death toll stood at 0. That was a statistical impossibility, given the severity of the crash. In Bay 4, the situation was catastrophic. A woman in her 50s, pinned under the tanker for 20 minutes, was drowning in her own blood. Her chest was crushed. "Tension pneumothorax," cried Dr. Sterling, a first-year resident who looked like he was about to vomit. I can't get the tube in." "Her trachea is deviated too far." The woman's face was purple. Her neck was swollen to twice its size. Air was trapped in her chest cavity, crushing her heart. If the pressure wasn't released in 60 seconds, she was dead. "Move," Sarah said, shoving the resident aside. "I have to intubate," Sterling protested. "She doesn't need a tube down her throat. She needs a hole in her chest," Sarah yelled. She grabbed a scalpel from the tray. "You are not authorized to cut," Sterling screamed, reaching for her arm. Sarah shifted her weight, dropping her shoulder and driving her elbow back into Sterling's solar plexus. It was a subtle, precise strike. The resident folded, gasping for air. The room went silent, save for the dying woman's gurgling. Sarah didn't hesitate. She poured betadine over the woman's rib cage. She palpated the fifth intercostal space. "Nurse Bennett, stop." It was Brenda standing at the door. "If you cut that patient, you go to prison. That is surgery." Sarah looked at the monitor. The heart rate was 30. "She's already dead if I don't," Sarah said. She sliced, a clean 3-inch incision between the ribs. Blood welled up, but Sarah ignored it. She reversed the scalpel using the blunt handle to separate the muscle, a technique used in field medicine, not sterile hospitals. She shoved her gloved finger into the chest cavity, breaking the pleura. A massive gust of bloody air sprayed out of the woman's chest. The pressure released. The monitor, which had been flatlining, suddenly beeped. Beep, beep, beep. The woman sucked in a ragged, desperate breath. Sarah grabbed a chest tube, fed it into the hole, and secured it. "Lung is reinflating. BP is stabilizing." She turned around. Dr. Sterling was on the floor, still wheezing. Brenda was staring at her with her mouth open. Dr. Matheson was standing in the doorway, watching the whole thing. "You just performed a thoracostomy," Matheson said quietly. "Without a local anesthetic, with a scalpel technique I haven't seen since..." He trailed off. He was looking at her hands. They weren't shaking, not even a tremor. "Where did you learn that?" "YouTube." Sarah said, her face blank. "Bullshit," Matheson snapped. "That was military. Special Forces medical protocol. Who are you?" Sarah ripped off her bloody gloves. "I'm the nurse who just saved her life. Now, if you'll excuse me, Bay 6 is coding." She pushed past him. Matheson watched her go. He felt a chill that had nothing to do with the air conditioning. He walked over to the computer station. He pulled up Sarah Bennett's employee file. Sarah Bennett, age 34, education, University of Nebraska, previous employer, Sunnyvale Hospice. He picked up the phone and dialed the number for Sunnyvale Hospice. It rang twice. "We're sorry," a recording said. "The number you have dialed is not in service." Matheson hung up. He Googled the University of Nebraska nursing class of 2012. He scrolled through the alumni list. Bennett A. Bennett J. There was no Sarah Bennett. He looked through the glass walls of the ER. Sarah was currently commanding a team of 3 paramedics, giving orders on drug dosages that were aggressive, dangerous, and absolutely correct. Matheson picked up the phone again. This time he didn't call a hospital. He called an old friend of his from college, a guy named Greg, who now worked at the Seattle PD. "Greg," Matheson said, his voice lowering. "I need you to run a name for me. And maybe a fingerprint if I can get one off a coffee cup." "What's going on, Henry? You dating a psycho?" "I don't know," Matheson said, watching Sarah stabilize a compound fracture with a makeshift splint made from a magazine and tape. "But I think I have a ghost working in my ER." 2 hours later, the chaos had subsided. The miracle at St. Jude's was over. 20 patients admitted, 0 fatalities in the ER. It was unprecedented. The staff was buzzing. They were calling Sarah a hero. The young resident Sterling had apologized to her, terrified of her skills. Sarah sat in the break room staring at a cup of black coffee. She looked exhausted. Her hands were trembling now, a delayed reaction. The break room door opened. It wasn't Brenda. It wasn't Matheson. Two men in dark suits walked in. They didn't look like hospital admin. They wore earpieces. "Sarah Bennett?" the taller one asked. He flashed a badge. FBI. Sarah didn't look surprised. She didn't jump. She just closed her eyes for a second, a look of profound sadness washing over her face. "My name is Special Agent Carter," the man said. "Please stand up and place your hands behind your head." Dr. Matheson burst into the room behind them. "Hey, what the hell is this? She just saved half the city." "She's under arrest, Doctor," Carter said, pulling out handcuffs. "For what practicing medicine without a license?" Matheson demanded. Carter snapped the cuffs on Sarah's wrists. He looked at Matheson with a grim expression. "No," Carter said, "for the murder of Senator William Halloway. And her name isn't Sarah Bennett. It's Dr. Natasha Roman." Sarah looked at Matheson. "I didn't kill him," she whispered. "That's not what the footage shows," Carter said, shoving her toward the door. The interrogation room inside the Seattle FBI field office was soundproof cold and smelled of stale coffee. Sarah, now identified as Dr. Natasha Roman, sat handcuffed to the table. She had been sitting there for 3 hours. She hadn't asked for a lawyer. She hadn't asked for water. She just stared at the wall, her pulse visible in her neck, slow and steady. Agent Carter threw a file folder onto the table. It slid across the metal and hit her cuffed hands. "Dr. Natasha Roman." Carter began pacing the small room. Graduated top of her class at Johns Hopkins, recruited by the CIA for the Special Activities Center. You were the lead field surgeon for Unit 7, the Ghosts. You don't exist on paper, do you? Natasha didn't blink. "I'm just a nurse." "Drop the act," Carter snapped. He leaned in his face, inches from hers. 3 years ago, Senator William Halloway went into cardiac arrest at a private fundraiser in D.C. You were the on-site medic. He died. The autopsy showed a massive dose of potassium chloride. It stops the heart instantly. Leave no trace looks like a heart attack. Only you had access to the medical kit. "I didn't kill him," Natasha said, her voice barely a whisper. "I tried to reverse it." "With what, a magical nursing trick?" Carter scoffed. "You fled the scene before the Secret Service could secure the room. You've been running for 1,095 days, and you blew your cover to save a bunch of strangers in a Seattle ER. Why?" Natasha finally looked up. Her eyes were exhausted. "Because that little boy in Bay 3, he had the same eyes as Halloway's son. I couldn't let another one die." Meanwhile, back at St. Jude's Medical Center, Dr. Henry Matheson was breaking the law. The hospital was still in cleanup mode, but Matheson had slipped into the locker room. He found the locker labeled S. Bennett. It was unlocked. Inside, there were no personal photos, no spare clothes, just a worn copy of Harrison's Principles of Internal Medicine and a small sealed plastic bag taped to the underside of the top shelf. Matheson peeled the tape back. The bag contained a USB drive and a small glass vial with a faded label. He rushed to his office and locked the door. He plugged the USB into his personal laptop, bypassing the hospital network. A single video file popped up. He clicked play. The video was shaky, filmed on a phone hidden in a pocket. It showed a lavish hotel room.